Hello everyone, welcome back. In today's session, we'll be studying about Hirschsprung disease. It is also called congenital aganglionic megacolon or Hirschsprung disease. Okay, any of these names can be asked. Okay, so let's start. Congenitally absence of autonomic parasympathetic ganglionic nerve cell in the submucosal, that is Meissner plexus and myenteric plexus of distal part of colon and rectum, that is rectosigmoid area, which result in extreme dilation of colon. So what they are saying, congenitally absence of autonomic parasympathetic ganglionic nerve cell in the submucosal, that is Meissner plexus and myenteric plexus of distal part of colon and rectum, that is rectosigmoid area, which result in extreme dilation of the colon. Okay, myenteric plexus is also called Orbach's plexus. Okay, more common in male than female, that is 4:1. So male are more affected. This disorder mainly found with Down syndrome. So it is linked with Down syndrome. 64% cases diagnosed till 3rd month of life. So its mortality, मतलब इसका जो rate है वो भी काफी ज़्यादा है, that is 64% cases diagnosed till 3rd month of life. Clinical manifestation, that is for infant, cardinal sign is unable to pass meconium within 36 to 48 hours of birth. So we know, right, that normal period of passing meconium is within 36 to 48 hours. But if one newborn baby is failed to pass meconium within 36 to 48 hours, we can suspect for Hirschsprung disease. Okay, abdominal distension within 1 to 2 days after birth. Refuse to suck, bile stained or fecal vomiting. So all these are seen in baby who is having Hirschsprung disease. So cardinal sign will be failed to pass meconium within 36 to 48 hours of birth. Abdominal distension will be there within 1 to 2 days after birth, and that baby will refuse to suck, and fecal vomiting or bile stained vomiting will be present. And in case of children, but let's see, vomiting and abdominal distension will be there. Foul smelling stool or maybe in pellet or ribbon like form. मतलब क्या है, इन चिल्ड्रन में क्या है, vomiting and abdominal distension is there, foul smelling stool is there, and maybe in pellet or ribbon like form. Ribbon में मतलब क्या है, like this, right? मतलब ऐसे, malnourished and anemia and constipation. Okay, and failure to gain weight and delayed growth. All these will be seen. Now coming to complications. Colonic mechanical obstruction due to inadequate motility in an intestinal segment. क्या है complication में, colonic mechanical obstruction due to inadequate motility in an intestinal segment. Hypovolemic shock and enterocolitis, a serious complication. So main serious complication is enterocolitis, and also colonic mechanical obstruction will be there. Hypovolemic shock can also happen. Clear? So let's see in picture now. Okay, see, this is basically a megacolon dilated with feces and gases. Okay, this part of the colon is this aganglionic region. Okay, ganglion cells is present in normal condition, but in this Hirschsprung disease, this part is aganglionic. Okay, so tonic contraction and inadequate peristalsis will be there. Enterocolitis is the complication, and partial obstruction also can happen, and it is due to chronic constipation. See, enlargement of proximal segment, then complete bowel obstruction. So definitely, right, here in this portion that partial obstruction will be present. Clear? Okay, so let's come to next part, that is diagnosis. Plain abdominal X-ray reveals severe gaseous distension of bowel. Okay, if we are doing a simple abdominal X-ray, it will reveal severe gaseous distension of bowel. Barium contrast enema to demarcate normal to abnormal part of colon. Okay, if we are doing barium contrast enema, then it will mark normal part and abnormal part of colon. Clear? Rectal biopsy shows absence of ganglionic nerve cells. It is gold standard for definitive diagnosis of megacolon. So this is the definitive diagnosis, rectal biopsy. Okay, now medical management. Okay, let's see. Give low residual diet like low fiber, high calorie and high protein diet. Daily rectal irrigation with normal saline to promote elimination and avoid obstruction. मतलब क्या है? We have to give low residual diet like low fiber, high calorie and high protein diet. Low fiber, high calorie and high protein diet we have to give to the baby. Then or child, right? Daily rectal irrigation with normal saline to promote elimination and avoid obstruction. Now coming to surgical management. Okay, so what are the surgical management now? Pre-operative management में क्या है? Maintain NPO, never take rectal temperature, measure abdominal girth, observe respiratory distress. Okay, these are all at the pre-operative management. Aim of surgery is to remove aganglionic, malfunctioning and dilated part of bowel followed by anastomosis of remaining portion. मतलब हम क्या कर रहे हैं? वो जो aganglionic part है ना, see in picture, this part we are removing. Okay, and जो remaining part है मतलब this part and this part, anastomosis of this part will be done. Clear? Yeah, let's see. It performs in 2 steps, that is initial surgery में क्या है? Temporary colostomy in ganglionic bowel to remove obstruction and allow dilated bowel to return to its normal size. तो क्या कर रहे हैं? इनिशियल सर्जरी में हम टेम्पोररीली कोलोस्टोमी कर रहे हैं इन गैंग्लियोनिक बावल टू रिमूव ऑब्स्ट्रक्शन एंड अलाउ dilated bowel to return to its normal size. Definitive और reconstructive surgery में क्या है? It involves complete surgical correction in which normal bowel attached to anal opening by pull-through procedure at the age of 12 to 15 months or at the weight of 7 to 9 kg. When baby is having weight of 7 to 9 kg or age of 12 to 15 months, we are doing definitive or reconstructive surgery. We are doing complete surgical correction in which normal bowel attached to anal opening by pull-through procedure. There are 3 types of surgery, that is, see, Duhamel's procedure. What is that? It is exam based question. Okay, so pay attention to these points. See, Duhamel's procedure, it is retrorectal transanal pull-through. What is that? Aganglionic colon proximal to rectum is rejected and side-by-side attachment of normal ganglionic colon to posterior wall of rectum performed. मतलब क्या बोल रहा है इधर? Aganglionic colon proximal to rectum is rejected and side-by-side attachment of normal ganglionic colon is performed. Okay, and it is attached to posterior wall of rectum. Okay, now Swenson's procedure. What is that? Rectosigmoidectomy, that is aganglionic segment of bowel cut and removed. Clear? So let's see. Aganglionic segment of bowel cut and removed, then remaining normal bowel attached to anal sphincter. Now Sweep's procedure. What is that? Sweep's operation. Let's see. This is endorectal pull through. Mucosa of rectum is removed and ganglionic colon pulled through the muscle sleeve of rectum and anastomosed with anus. Okay, Sweep's operation में क्या बोल रहा है? Mucosa of rectum is removed and ganglionic colon pulled through the muscle sleeves of rectum and anastomosed with anus. Clear? The optimum age for reconstructive surgery is 6 to 8 months. Okay, we are doing it between 6 to 8 months after temporary colostomy. That is initial surgery. Now coming to post-operative management. Avoid taking rectal temperature. In pre-operative part also the same point has been told that we should not take rectal temperature. Clear to all of you? Avoid taking rectal temperature. Observe redness, swelling and drainage at surgical site. Observe stoma. Stoma should be pink and moist. Apply zinc oxide ointment on skin around stoma. Keep the patient NPO till normal return to bowel sound. Okay, so we have to keep the patient in NPO till normal return of bowel sound. Normally it heard within 48 to 72 hours of surgery or flatus pass. Okay, after returning normal bowel sound, provide non-irritating bland diet. So when the normal bowel sound has returned, we have to provide non-irritating bland diet. Hope it is clear to all of you. Hirschsprung disease is an exam based question both in competitive exam and university exam. They ask in 5 marks question, sometimes in tricky MCQ question. So study well, and if any doubt is there, let me know. See you in next video. Thank you so much for hearing me.